Non-metastatic castration-resistant prostate cancer is heretofore been a disease state in prostate cancer for which there's been no treatment. Turns out not all patients with non-metastatic disease are the same, but we can risk assess. And patients that have high risk features, such as a very short PSA doubling time, we know are destined to progress, to develop metastases and die. Currently, there's no standard of care for those patients. So we sought in SPARTAN to test apalutamide as a drug to prevent metastases and delay or increase the metastasis-free survival interval. The design was very straightforward. Patients that had negative CAT scan of abdomen and pelvis and a negative bone scan, so non-metastatic disease by conventional standards, were randomized in a 2-to-1 fashion to receive either apalutamide or placebo. I should say also that the entry criteria required a PSA doubling time of less than 10 months because this identifies patients who are at risk for events. Patients were randomized and were treated in addition to conventional androgen deprivation therapy until an event defined as metastasis. Metastases were defined by independent review. Scans were done routinely. PSAs were not followed as a means to determine progressive disease. Secondary endpoints of the study included other endpoints between the time of metastasis and death, so things like symptomatic progression-free survival, time to secondary therapy use, and ultimately overall survival.